Chapter 19 discusses nutrition and how it relates to liver disease. Our liver is the most active organ in the body, and when it's diseased, the disease may progress very slowly, particularly in cases of fatty liver disease and hepatitis disease, which we will discuss in detail. Some important roles of the liver include processing, storage, and redistribution of our nutrients. It also produces bile. Bile is the substance that allows us to emulsify and absorb fat. The liver also makes a lot of protein. It synthesizes lots of protein that our bodies need. It also detoxifies any drugs or alcohol that we ingest, and it processes excess nitrogen. The first liver disease we'll talk about is fatty liver, and it is what it says it is, a fatty liver. If you look at the two pictures, the normal liver, you see have nice uniform cells, and the fatty liver, you can actually see the flat globules in there. So fatty liver is caused by alcoholic liver disease, so excess drinking can lead to a fatty liver. And exposure to drugs and toxic metals can also lead to a fatty liver, as well as inherited disorders. Other things that can lead to fatty liver may include malnutrition. Also, fatty liver can be seen in a person who is on IV nutrition for long term. Fatty liver is associated with obesity, diabetes mellitus, two conditions we discussed in Chapter 5 known as marasmus and kwashiorkor. These are both deficiencies in protein and energy. And also with gastro bypass surgery, we see fatty liver. And again, with long-term IV nutrition, also known as TPN, we can see fatty liver. Some of the consequences of having a fatty liver include liver enlargement, inflammation, fatigue, abnormal liver enzyme levels, and increased triglycerides in the blood, also increased cholesterol and increased glucose. Treatment for liver disease includes eliminating the cause. So if the cause of liver disease is alcohol, then excess alcohol needs to be cut from the diet, or you need to go to rehab. Lower lipid levels. If you have high triglyceride levels, you need to lower them. Stop alcohol use. If you are on a drug treatment that's not working for you and that has resulted in liver disease, you may need to have your medications adjusted. Weight loss can be beneficial for fatty liver, and also it's important to control your blood glucose. Okay, the name hepatitis refers to inflammation of the liver. Now, there are different types or different causes of hepatitis. We may be most familiar with the viral hepatitis, which include hepatitis A, hepatitis B, and hepatitis C, and less commonly known are hepatitis D and E. Excess alcohol intake can cause hepatitis, which is again inflammation of the liver. Exposure to certain drugs and toxic chemicals can also lead to hepatitis, and some herbal remedies can also lead to liver inflammation. The three most common types of viral hepatitis include hepatitis A, hepatitis B, and hepatitis C. Hepatitis A is a very common, extremely contagious form, and this form of hepatitis is transmitted via the fecal-oral route, or the route of a person not washing their hands if they're infected with hepatitis A, and then preparing food and the virus being transmitted that way. Hepatitis B is transmitted through blood or sexual contact. There is a vaccination available for hepatitis B, and I believe there's also a vaccine for hepatitis A. Hepatitis C, this is a major cause of chronic hepatitis, and it can be spread via blood contact, and that could be from sharing needles. What this table is showing you is that hepatitis C is the most common cause of chronic hepatitis in the United States. Hepatitis A, it's transmitted via the fecal-oral route. Hepatitis B is bloodborne or sexual transmission, and hepatitis C is bloodborne. There are vaccines available for Hep A and Hep B. However, there is not a vaccine available for hepatitis C. The symptoms of hepatitis may be mild or chronic, or it may be asymptomatic. Asymptomatic just means that there are no symptoms. When you put A in front of that word, it means not. So, people who have symptoms may have acute symptoms. These are symptoms that are going to be sudden onset. They may include fatigue, nausea, or anorexia. Anorexia just means poor appetite when used like this. Don't get that confused with anorexia nervosa. So your appetite may decrease. Pain in the liver area. So if you feel right under your rib cage, on the right side, that's your liver. On your right side, that's your liver. Fever, muscle weakness, skin rashes, and also elevated liver enzymes on blood work may show up. Treatment for hepatitis includes supportive care, bed rest, a nutritious diet. Persons who have hepatitis B and hepatitis C may need antiviral medications. These are medications that fight viruses. They stop the replication of a virus. If it's non-viral hepatitis, person may benefit from anti-inflammatory drugs or drugs that actually suppress the immune system. As far as nutrition is concerned in the treatment of hepatitis, many require no dietary changes. If anything, if there's nausea, then small frequent meals may be recommended. Of course, adequate protein is always important. A low-fat diet may be needed. If you have a fatty liver and your liver's not producing adequate bile, then you will have trouble digesting fat. So you may need a low-fat diet. Just depends. And also fluid and electrolytes may need to be replaced if there's vomit. Cirrhosis, liver cirrhosis, is an end-stage condition, meaning that you cannot come back from this. This is an end-stage condition. This is the death of your liver. This is how your liver dies. With cirrhosis, there is diffuse scarring and fibrosis. The liver takes on an irregular nodular appearance. And as you can imagine, a liver that looks like this, a liver that's scarred up, is not going to function well. So your liver is just going to eventually fail. Common causes of cirrhosis may include chronic hepatitis C. So chronic hepatitis C may lead to liver cirrhosis. Another cause, alcoholic liver disease, consuming alcohol to excess. Bile duct blockages, remember in Chapter 2, we talked about the common bile duct. This is the duct that leads from the liver to the gallbladder, or the gallbladder to the small intestine, or from the pancreas to the small intestine. Okay, so a duct can be blocked, causing liver cirrhosis. All untreated types of chronic hepatitis can lead to cirrhosis. Liver injuries that are caused by drugs or drug abuse, and some people inherit conditions that cause them to end up with liver cirrhosis. 40% of people with liver cirrhosis are asymptomatic, meaning they don't have any symptoms, but the initial symptoms that you're going to have, if you have symptoms, include fatigue, feeling tired, weak, low appetite, and also weight loss. Later symptoms of liver cirrhosis could be anemia, meaning that you don't have enough oxygen in your red blood cells, or your red blood cells aren't able to carry enough oxygen to your tissues. Blood clotting impairments, increased susceptibility to infection, jaundice. Jaundice is a yellowing of the eyes and or skin. Fat malabsorption, and this may manifest itself as fatty stool or fat droplets when a person goes to the bathroom. And also ascites and varices, which we'll talk about. The portal vein is a vein that leads to the liver. When a liver is cirrhotic, or you have liver cirrhosis, then there is a lot of scar tissue that develops. As a result of this scar tissue, your liver is not able to filter blood properly. As a result, blood will be backed up into the portal vein and put pressure on that vein. Now, that is called portal hypertension. As a result of portal hypertension, there is a type of varicose vein that develops, and it develops in the linings of the esophagus and the upper stomach. Now, the veins will fill and enlarge due to an increased pressure in the portal veins. So, as a result of a cirrhotic liver, varicose veins can be formed in the esophagus and stomach. They may enlarge and they may burst. When they burst, you can have internal bleeding and you can eventually die from that. Another thing that happens in a cirrhotic liver are the formation of collateral vessels. Collateral vessels may be pre-existing vessels that normally have little or no blood flow. And so in a cirrhotic liver, there can be acute occlusion of normal vessels, meaning they can be blocked off. So blood has to be redistributed. So the redistribution of blood and pressure within the vascular bed causes blood flow to occur in a collateral vessel. So blood is being diverted into vessels that normally have little or no blood flow. Okay, so in portal hypertension, blood backs up into the portal vein. Okay, the reason that blood backs up in the portal vein is because the liver is scarred and it's not able to filter blood properly. Okay, blood and fluids. So a lot of pressure is put on the portal vein, and as a result, varices form and collaterals become enlarged and engorged, and they may rupture. If they rupture, they're most likely going to rupture in the esophagus or the stomach. Make sure you understand what varices are and what collaterals are. Esophageal varices occur in the esophagus, and gastric varices occur in, you guessed it, the stomach, in and around the stomach. Another consequence of liver cirrhosis is ascites. This word just means an accumulation of fluid in the abdominal cavity. Now, ascites can result as a result of portal hypertension, so you have fluid spilling into the abdominal cavity, or it could be a result of reduced albumin. Albumin is a blood protein that helps your body's fluids stay in the right compartments. So whenever you have low albumin, fluid can spill over from your intravascular spaces into your interstitial or interstitial spaces, and these are the spaces in between cells. So you get a light spilling of fluid into the abdominal cavity because of that reduced protein called albumin. As you could guess, someone who has an accumulation of fluid will likely have some weight gain and abdominal discomfort and early satiety, which means early fullness or early satisfaction. Here's a procedure that can be done on somebody who has ascites. There is a bag with a catheter stuck into it. This is called a paracentesis. This is when fluid is drained from the abdominal cavity through a catheter. Another consequence of cirrhosis is hepatic encephalopathy. This refers to an inflammation of the brain or a condition in which the brain functions abnormally due to abnormal liver functioning. As a result of hepatic encephalopathy, and this affects the brain, a person can experience amnesia, changes in behavior or personality, seizures, or they can go into a hepatic coma. This is a coma that's induced by problems with the liver. Hepatic encephalopathy, also elevated blood ammonia is another consequence of cirrhosis. And that can cause problems with neurological functioning, can cause changes in personality. If you've ever smelled ammonia, you know that it's toxic. So if you have a compound similar to that in your bloodstream, it's potentially damaging to your tissues, particularly the brain tissues. Malnutrition, wasting may occur because your body isn't able to synthesize all the protein that it needs. And also you may have a decreased appetite, so you don't want to eat. And if you're still drinking, then you're probably replacing a lot of calories with alcohol that could be replaced with nutritious foods. For the treatment of cirrhosis, it's going to be individualized, and supportive care is going to be given. That's going to provide an appropriate diet and education on the importance of the avoidance of liver toxins. It will include abstinence from alcohol. It may include a liver transplant. Remember, cirrhosis is what we call an end-stage disease. Drug therapy may include diuretics. Diuretics are medications that are used to help relieve somebody of water. So they encourage water excretion. Appetite stimulants to help combat malnutrition. If you're eating more, you have a better chance of getting more calories, more protein, less chance of wasting away. Medical nutrition therapy recommendations for energy may be elevated. Small meals are going to be recommended, 4 to 6 small meals a day. Adequate protein needs to be maintained. It may be the RDA for protein, so a person may need to get the same amount of protein if they didn't have liver disease, which is 0.8 grams per kilogram of desirable body weight per day, up to 1.2 grams of protein per kilogram of body weight per day. Complex carbohydrates are recommended for us all, not just those with liver problems. They're particularly important for people with liver problems. And also, fat may need to be restricted for people who experience steatorrhea. Steatorrhea refers to fatty stools or fat in the stool. For someone with cirrhosis, sodium and fluid restrictions may be needed. Sodium helps our bodies to retain water, so cutting down sodium would be important to retain less water. So if a person has ascites, it's going to be necessary. Or diuretic therapy can be given, and diuretics, as we mentioned, are medications that encourage the body to excrete water. Vitamins and minerals may be recommended. Some people may need liquid forms of vitamins. And also, specialized nutrition may be needed. Enteral nutrition is a type of nutrition that goes in the GI tract. So nutrition supplement like Boost would be enteral nutrition. Parenteral nutrition is nutrition that's given outside of the GI tract. So it means IV nutrition. So enteral means nutrition given via the GI tract, whether it's through a stomach tube or through your mouth. And parenteral nutrition refers to nutrition given via an IV. And that's going to depend on, it's going to be a case-by-case basis. Here's what IV nutrition looks like. This particular type of nutrition is called TPN, or total parenteral nutrition. Total parenteral nutrition is IV nutrition delivered through a large central vein, like through the heart vein or the superior, the subclavian vein. Here are those medical nutrition therapy recommendations we went over for liver cirrhosis. When liver failure occurs, liver transplantation is going to be the only option. Hepatitis C and alcoholic liver disease account for about 50% of cases for people who need liver transplant. It's because of Hep C or alcoholic liver disease. Most patients are already malnourished, so it's important before going into liver transplant to be nourished. That can be achieved by appetite stimulants, and if a person can't meet their energy needs still, they can also meet them through IV nutrition, and that may be through a stomach tube, or it could be through TPN, like we saw on the last slide. After the surgery, the person is going to have increased energy and protein needs. Whenever someone has a major surgery like that, increased protein is needed and increased energy is needed. So a person may still be on IV nutrition after a liver transplant. So before and after, a person might need to receive artificial nutrition just to make sure that they're strong enough for the surgery beforehand and then afterward to improve wound healing. There are some concerns after transplant that may include organ rejection or infection. Immunosuppressive drugs will affect nutrition status. Some immunosuppressive drugs may increase blood glucose levels, so those may need to be monitored. And afterwards, you're going to need increased protein and increased energy. Also, with immunosuppressive drugs, you got to be careful about what it is that you're eating. Fresh produce may not be the safest. You need to make sure things are washed. You're drinking pasteurized milk. You're staying away from buffets, because your immune system, when you're giving them, you're going to be less able to fight off infection. So be careful what you eat, where you go. Alcohol is the primary cause of liver disease. It can be toxic to our brains, our gastrointestinal tract. It can be a gastric irritant, and it can be toxic to our pancreas. Abuse of alcohol can lead to nutrient deficiencies. A lot of times when you're abusing alcohol, you're replacing calories that you could have, where you could have been fitting in fruits, vegetables, whole grains, and legumes. However, moderate alcohol intake actually is beneficial and can help with heart disease. For older adults who have heart disease or at risk for heart disease, moderate alcohol is beneficial. It can help increase your HDLs, which are your good cholesterol, and may reduce the tendency for blood clotting. So may help with the heart by maybe reducing risk of stroke or heart attack. The dietary guidelines for alcohol, if you use alcohol, is women get to consume 1 drink per day and males 2 drinks per day. 1 drink counts as 12 ounces of beer, 5 ounces of wine, 10 ounces of wine cooler, and 1.5 ounce of 80 proof spirits. Not all together, but you pick one. Or if you're picking 2, you pick 2. Alcohol is, of course, contraindicated in pregnant and lactating women. I don't know if y'all have seen this show called Slap. That's on NBC, but there's this mother on there who is actually breastfeeding her child, who is about 5, and she's drinking alcohol and doing that, and the child's got anger issues. Wonder why? Probably has fetal alcohol syndrome. Children and adolescents shouldn't drink. Their brains aren't developed yet. People who take medications that have interactions with alcohol should avoid drinking. If you are unable to stop voluntarily, you need to go to rehab. And you shouldn't drink when you're participating in activities that require your attention and your coordination.